Hi, welcome again. Okay, so my name is Kenneth Mututua. I'm a fourth year B physiotherapy student. So I'll be explaining on the cardinal features, or let me say the clinical features of Parkinson's disease and its management. So I'll be very fast due to the bulk of the presentation. Alright, so I'll start by defining the Parkinson's disease. Parkinson's disease is a progressive neurological disorder primarily caused by the degeneration of dopaminergic neuron in the substantial nigra, of a basal ganglia, of course. So, pathophysiological features. So there is a loss of dopaminergic neuron, which leads to the depression of dopamine in the striatum. The Lewy body's abnormal aggregation of alpha-nucleic protein found in the surviving neuron and neurotransmitter imbalance. So there is dopamine, reduction, which is the inhibitory neuron, and there's also increase in the acetylcholine, which increases excitatory motor dysfunction. Involvement of other neurotransmitters such as norepinephrine and serotonin, genetic and environment. So on the genetic is just about 10% cases. There is mutation in the RK2 and the PAG7, PINK7, and the synucleic also alpha. Alright, so environmental exposure to pesticide also can cause this, e.g. the heavy metal, the head trauma. So clinical features. On the clinical features, cardinal features, there are four cardinal features. The first one, bradykinesia, which is the slowness of movement, and the second one is resting tremor, which is pure rolling tremor, that is 4 to 7 8 rigidity, cogwheel or lead pipe rigidity. Then the last one, which is postural instability, which is the late stage symptom, balance impairments. So on the postural instability, we can also find, there will be fascinating gait, there will be also increased base of support, and there is also catch and release kind of gaits. So there is such kind of, symptom or clinical features. On the non-motor symptoms, so about 30%, they do experience the decline in the cognition. About 75% they also experience depression, most of them. Autonomic dysfunction, most of them, like sexual dysfunction and also urinary dysfunction. So e.g. constipation, orthotic hypotension, and sleep disturbances. Sorolia, and also maybe, let me say, there will be monotonous of speech. There will be problem with the dysentery. So medical management, we can say levodopa plus candidopa, which is a gold standard. And side effects, there is a bit of dyskinesia, motor fluctuation. Dopamine agonists. Some of the things I'm not going to read them due to time. So anticholinergics also you can use, and COMT inhibitors. Amantadine, mild symptomatic relief, reduce dyskinesia. Surgical intervention, deep brain stimulation. Electrodes implanted in the substantial nuclei. So lesion, palidotomy and salamotomy, but this is rarely used, even as mentioned just from the screen. Physiotherapy management. So improved mobility, balance and posture, reduce rigidity and bradykinesia, enhance functioning and independence, prevent falls and secondary complications. So gait training, there will be cueing strategies, treadmill and large amplitude movements. Balance postural control, perturbations training, weight shift training, and tai chi yoga, and flexibility training, which is stretching, resistance exercises, respiratory exercises, incentives, spirometer, you can use breathing exercise, you can use, and any other, let me say, Okay. And these are the references from down here. Otherwise, thank you so much.